Hello, everybody. I am Dr. Neeraj Dhingra, and I am a consultant in Radiation and Clinical Oncology. Basically, cancer is a disease in which some of the body's cells grow uncontrollably and then they spread to other parts of the body. So, breast cancer is a cancer that arises in breast. It originates in some cells of the breast, and then it can either grow, it can keep on growing there, or it can start to spread to other parts of the body. So basically, it's uncontrolled growth, which is not controlled by any of the cell cycle modifications that happen in the body. But the cells have uh, somewhere a break in the cell cycle, and because of which the cells keep on growing, with which the growth is unregulated, and none of the body's mechanisms are able to control it. So that is why a cancer develops. So breast cancers are basically developing from the different components of the breast. The most common of that is ductal carcinoma, which begins in the cells of the ducts. So this type of breast cancer constitutes about 70 to 80% of all breast cancers. The second most common type of breast cancer is lobular carcinoma, which begins in the lobes or lobules. So basically, in the anatomy of the breast, there are lobules which create milk, which form lobes that continues as ducts and which goes to the nipple areola system. So these are the different components of the breast, out of which lobules and ducts, if there is an aberrant growth of the cells in those parts, then the cancers develop in them. So ductal carcinoma, lobular carcinomas constitute majority, around 95% of cancers of the breast cancer. However, rarely some other types of breast cancers like lymphoma or sarcoma can also develop. Cancer is mostly a disease of old age. So, the first and foremost cause of a breast cancer is older age, and it has been seen that as the age progresses beyond 50 or 60, females have a higher risk of breast cancer as the age progresses. Now, there are certain other factors related to family history. That means if a female has history in the family, like her mother or sister or maushi or atya, these people have had a history of breast cancer, then these patients are considered to be at a high risk of breast cancer. Also, this can be because of alteration of certain genes, the most common of which is known as a BRCA gene. So the mutation in these genes is responsible for around 8 to 10% of breast cancer patients. There are certain lifestyle related changes that have happened across the age groups in females, and which now lead to an increase in estrogen exposure. So, estrogen is a hormone which is synthesized in the human female body, and it is responsible for basically development of breasts, the ovulation. So this is an essential hormone in females. But if a prolonged exposure of estrogen happens into the female body, it can lead to the breast cancers. Now, the lifestyle changes which have led to the increase in these breast cancer incidents are menstruation, which starts at an earlier age, marriages that are getting delayed, because of which the first stage at which pregnancy happens is also delayed. Mostly now pregnancies are happening after the age of 30, somewhere even happening after 35 years. So this leads to an enhanced exposure of estrogen to the breast. And that is why breast cancer is also increasing now in females between the age of 30 to 50. Also, starting menopause at a later age, as females attain menopause at an age of around 50. But if menopause happens later than that, can also be an increased risk factor for breast cancer. Similarly, giving hormone replacement therapy after menopause, which might be only estrogen therapy, can also predispose a female to the risk of breast cancer. Uh, Other risk factors are increase in obesity, reduction in physical activity, increased alcohol consumption. So, all these are considered as risk factors for breast cancer. Breast cancer, because it develops in breast, is actually pretty easy to find out whether a female is suffering from breast cancer or not. So the most common finding is that the female will feel a lump or a nodule in the breast or in the axilla. So axilla is the corresponding part below the arm. So breast or axilla, you find a lump or a nodule that is not going away and is increasing in size is suspicious for a breast cancer. So at any point of time you develop a nodule or a lump which is not going away, is constantly increasing in size, usually painless. This is a trigger for going to a physician for getting a checkup. Similarly, many a times females are usually not very willing for going for a checkup, and then the lump increases. It can then increase to such an extent that it goes on to involve the skin, or it can go on to involve nipple or to the chest wall, the muscles below the breast tissue. So when these things are involved, then there can be a puckering of the skin. There can be discharges from the nipple which are not usual. For example, only breast milk is considered, or something watery which might occur very rarely is okay. But you get a constant discharge of non milk like secretions from the nipple, like bloody or a greenish discharge, is a risk factor for is a definite sign for breast cancer, and you should definitely go to a physician for a checkup. Similarly, all these signs are when the breast cancer is limited to the breast. However, there can be other signs also, because of which sometimes a breast cancer is diagnosed, and that usually happens when the breast cancer has spread to other parts of the body, which might be the bones or the brain, lung, liver. So any other organs, when the cancer is metastasized, you can get symptoms because of that. And sometimes patients present to us with a bony pain in the vertebral column, or they may present to us with vomiting and a headache. So these are symptoms of metastasis, and during the workup, then we are able to find out that the cancer has spread to other parts of the body. And because of that, then when we do the biopsies and try to confirm, then we find out that the cancer has originated in the breast. Old age is considered as having the highest risk of breast cancer. So females above the age of 50 are usually considered as being at the highest risk of breast cancer. However, we are frequently seeing a demographic change in the incidence of breast cancer, and now females as young as 20, 30, or 40 are also presenting to us with breast cancer. If any female has a family history of breast cancer, then they are at a high risk of developing breast cancer at a younger age also. Breast cancer can be diagnosed by multiple modalities. Mammogram is one of those modalities. So it is basically an X-ray of the breast. So in which a normal X-ray, how it is done is we stand and an X-ray beam is shot, and behind us there is a radiographic plate on which the image is captured. Here there are two plates, in between the breast is compressed and an X-ray of the breast is taken. So a mammogram is basically an X-ray of the breast, but it is done in a slightly different way as a normal X-ray is done. So a mammogram, as per guidelines, is utilized for screening of breast cancer. Now, screening means that we are trying to detect the breast cancer at its earliest stage before it has developed any symptoms. So we are trying to diagnose it and then treat it. So screening mammogram is advisable beyond the age of 50 years in average risk females. So a patient who does not have any family history or does not have had any history of breast cancer before is considered as an average risk patient. So for all these patients beyond 50 years, the guidelines suggest that a manual mammogram, that means a mammogram once a year, can be conducted in 1 or 2 years. So the guidelines state mammogram annually once a year in 1 to 2 years can be conducted for average risk patients. However, for females who are at a higher risk, as I have explained, mammograms can be conducted earlier than 50 years also. For example, if the index case or the first case in the family was diagnosed at 40 years, so the mammograms, or in younger females, we prefer sonographies of the breast because the breast tissue is dense. So if we want to do screening of the breast before the age of 50 in a female whose breasts are going to be dense, then a sonography once a year can be advised, starting from the age at which the index case was diagnosed. The treatment for breast cancer, as for any other cancers, is defined based upon the staging. So before starting any treatment, it is essential that the staging procedures are complete. The staging procedures will most often require a scan, which can include a mammography, a sonography of the abdomen, or a PET CT scan can be advised if the tumor size is big or if it has spread to the axilla. So these imagings will tell us where the tumor is limited to the breast, to the axilla, or it has spread to the other parts of the body. Then to confirm that it is breast cancer, we need to do a biopsy from the lump or from the axillary node if from the lump it is not feasible. On the biopsy, once it's confirmed, then we have a definite diagnosis of a breast cancer. We have a staging based upon imaging, and based upon the stage, then the treatment will constitute of a combination of treatments. The most common treatment is surgery, which will include removal of the lump and the axillary nodes with or without removal of the complete breast tissue, which is known as a mastectomy. Now, this can be preceded or followed up with chemotherapy based upon the size of the tumor and the indications. Thirdly, radiotherapy can be utilized for treatment of breast cancer. If breast conservation has been done, then we give radiation to all those cases. And if a MRM has been done or a mastectomy has been done, then if depending upon some high risk factors, we decide whether radiotherapy should be added to the chest wall or not. Besides chemotherapy, then there are multiple other treatment options which are available. For example, if a hormone sensitive tumor is given tamoxifen or aromatase inhibitor drugs. So these can be added post completion of treatment. Targeted therapies are also utilized, like an injection known as trastuzumab is given if the tumor is HER2 positive. Similarly, there are multiple options available for hormonal therapy, targeted therapy, chemotherapy, immunotherapy. So all these options can be utilized based upon their indications. First and foremost, based upon our personal activity, we can increase personal activity. A female who is physically active and is not obese definitely reduces her risk of having a breast cancer. Secondly, breast tissue should have a less exposure to estrogen. So the lifestyle changes that I have mentioned, like delayed pregnancy, avoidance of breastfeeding. So if these factors are avoided, for example, I'm saying not saying that early pregnancy should be practiced, but before 30, if a female undergoes pregnancy and is breastfeeding, as used to happen with say last generation up to last generation of females, then it is definitely a protective factor for avoiding breast cancer. Similarly, post treatment, then we have drugs which reduce the risk of having breast cancer. Also, whenever hormone treatment is anticipated, for example, if OC pills are needed to be taken or a hormone replacement therapy needs to be taken, then only estrogen therapy should not be given. Estrogen and progesterone combined treatment should be given. Similarly, if a patient is a known case of BRCA mutation or another genetic mutations, then mastectomy, prophylactic mastectomy can also be considered. That means, for example, if the patient has had right-sided breast cancer, then a prophylactic left-sided mastectomy, that means removing the breast after family is completed, can be considered to reduce the risk of breast cancer. Also, oophorectomy, that means removal of ovaries, can also be considered after completion of family, so that the breast cancer risk can be reduced. This is mainly done in the cases in which a female has had breast cancer, or is it a higher risk because of her genetic mutation status.